There are a lot of terms out there used to describe shoulder injuries in swimmers, and I'm wondering if we can try to bring some clarification to that. And why don't we just start with the term swimmer shoulder? Can you tell us more about that?
Well, I don't particularly like that term as a diagnosis or a treatment. Every swimmer has two shoulders, so that's one thing. But the problem is that what this means is shoulder pain in a swimmer. And there are probably three reasons that most swimmers get pain in the shoulder. The first would be some type of an instability where the shoulder slides in and out of the socket. It may be gross, like it dislocates, but most commonly it's what we call subluxes. It slides back and forth, so it doesn't stay in the socket. That's a problem because, first of all, it hurts. Second, when you have this unstable shoulder, you can't develop the force to pull your arm through. That's the first way that you get this swimmer shoulder. The second is a rotator cuff tendonitis. The rotator cuff is the muscle group that holds the ball into the socket in the shoulder, and it generates the force around the shoulder. It either gets fatigued or it gets plain overloaded, and you can get this tendonitis. The third reason people can get pain in the shoulder is that they'll have what we call impingement. Something around the bone will pinch against something around the muscle, and a lot of times that will create pain as well. So those, when you're talking about swimmer shoulder, those are the three things. Now, in terms of the instability, usually there'll be a sliding or a catching or a popping or a feeling of pain, usually as they start out of the water, as they come from out of the water to try to grab water and pull through. That's usually when they're going to have their pain in the unstable shoulder. In the rotator cuff tendonitis, once again, there'll be pain. There'll be difficulty doing overhead activities. They're usually not too bad in a breaststroke, for example, maybe not even butterfly, but backstroke and freestyle are very difficult because you're having to do a whole lot more use of your arm with your rotator cuff, and there'll be a lot of fatigue when they get through. The impingements, once again, that's usually as you get your arm into the overhead position where you will pinch and rub, and you'll have the sharp pain as they go through that motion.